In this first free training video, I will talk to you about how I left a career as an unappreciated nurse in the traditional system and found a way to put my nursing expertise to a lucrative use as an RN health coach. I like to just take a couple of minutes to share with you my personal story, what my solution was, and the secrets that I have learned along the way. Believe me, I've been right where you are, and I know the type of situation that you're in, but I also believe that I can help move you beyond that and onto something that is going to make you happier than you ever thought possible. Spend a couple of minutes with me, and I believe you will find that I have a solution that can help. Today, I stand before you calling my own shots in life. I have found a way to take charge of my career and empower others to do the same with theirs. I've done all this without anyone else in charge or telling me what I needed to do. I feel a level of accomplishment and satisfaction for having helped more people than I can have ever reached before. But I can tell you that it wasn't always this way. Not at all. Before I learned what I would teach you, I felt like most nurses felt. That is, underappreciated, overworked, stressed out, underpaid, and unfulfilled. I'm sure you probably share many of these same feelings, right? Trust me, there are more people feeling like you in the field of nursing than you would realize. My story probably sounds familiar to you, but you may want to know how I came up with the idea of being an RN health coach. I'm also a registered nurse, someone who has been working in the field for over 10 years now. Just like most people, I was excited when I graduated from nursing school. It was my goal to help as many people as possible and willing to work long hours to show just how dedicated I was. But then things began to change, and not for the better, that is. I realized that I wasn't being valued in my role and for my expertise. I also began to realize that I was often undervalued. As a nurse, I simply wanted to make an impact on others, but I found this hard to accomplish as I often felt overwhelmed and faced with issues such as inadequate staffing. My sense of security began to suffer as I began to see other hardworking nurses around me lose their jobs due to things such as budget cuts, layoffs, and hospital strikes. What may be different with my story is, at the same time this was all going on, I also always had a dream of having my own business. I wanted to be the person who called the shots in my life. I wanted a successful business without anyone in charge but me. Having this would give me a sense of respect, leadership, and accomplishment. But as a registered nurse, I just always had in my mind that I would always have to answer to someone. I decided to start making a few changes in my life, and I enrolled in some business and marketing courses. It was then that I came up with the idea of becoming an RN health coach. Once I realized that this offered something that others weren't providing, everything seemed to change. I became an RN health coach, and I developed the brand and company Light Therapeutics. Light Therapeutics, Light is an acronym which means lose inches in illness through education or encouragement. Light Therapeutics was founded to fulfill the need and to help other healthcare professionals become established in their own communities. Our purpose is twofold. First, we want to become the foremost resource to consumers seeking to change their own health by providing a health coach in their own community. Second, we want to support existing health coaches by spreading the word about their services and providing the education and training needed to become a health coach. I developed the site rnhealthcoach.com. Our goal at Light Therapeutics was simply to provide an exemplary wellness coaching program with a concentration in weight management that will provide education, motivation, and incentives to reduce the modifiable risks associated with weight-related health complications. Now, by combining the skills that I learned in nursing and coaching principles, I began to develop the RN Health Coaching Program, which has been well received by nurses like you across the country. Today, I am eager to pass this information to you because I want you to use your own nursing skills and become a successful entrepreneur just like me. I've done all the research, laid the foundation, and I've tested out the program on myself. I am confident that this is going to be a life-changing step for you as a nurse, and I'm so excited to help you with this journey. Instead of giving all your energy, expertise, and skills to a hospital or other health institution, you can take these items directly to the consumer, making a bigger impact on their lives while maintaining control over your career. Everything I have learned in my formal business education, I have applied to my career as an RN health coach. Plus, I have created a step-by-step process that allowed me to become successful without any of the downsides of nursing. With this program, you can expand your job options while traditional nursing jobs dwindle. You will also have the freedom to share your expertise independently without conforming to the rules and restrictions of hospitals and other healthcare offices. What's more, you'll be your own boss and have the flexibility with when you work and your patient protocol. People began to ask me about my program and how I became so successful, which led me to helping others. This is how I came to create what is now the RN Health Coaching Training Program. Not only have I succeeded at a health coaching business with rnhealthcoach.com, but I also coach people to success with the business skills I have, as well as the hands-on success of my sites. Here's what I want you to know. My goal is to help you to save you time, effort, and money. I don't want you to struggle the way I did because I know that that's just not necessary. I know that you can have the same success that I've had with fewer headaches. Let's take a moment to talk about what the problem is in the nursing field. What is it that's making so many nurses feel like they want to leave the field? There's a lot, actually. There are 2.6 million nursing positions in the country, and there are already 120,000 nurses working outside the field in a variety of positions. According to the American Healthcare Association, the national RN vacancy in America is around 8%, putting a total vacancy around the nation at over 135,000. The most common reason that nurses cite for leaving the field is that they are not satisfied with their place of employment. In a 2005 survey, 93% of nurses cited the nurse shortage as a reason for leaving the field. The shortage of nurses leads to those who are working to become feeling like they're overworked and stressed, thus lowering their workplace satisfaction. Let's face it, over the years, hospitals have changed. There have been numerous cutbacks, skyrocketing costs, profit issues, strikes, and a significant decrease in patient volumes. There has also been a reduction in reimbursement from government programs and commercial health plans to hospitals. Hospitals seem to believe that nurses are expendable and lay many of them off. Now, once they do, many of those nurses still on board become overworked as they have picked up the slack of being short-handed. Take Nancy, a nurse with years of experience, training, and who has a passion and love for making a difference. Now, she currently trades her knowledge for the benefit of the hospital, yet she goes home always feeling shortchanged as if she's given far more than she's getting back. After years of this, it takes a toll and she is desperate for something else. Does this sound familiar? Right? I'm sure many of us can relate. But here's something to think about. Nurses can actually create more satisfaction by taking their skills directly to the public. That's right. There's no reason to go through a middleman such as a hospital. You can take your healthy messages directly to the public and be your own boss while you do it. As it is right now, and probably the position you are in, your talents, education, skills, experience, and training are all going to the CEO of hospitals so they can profit off your abilities. This is a new time, nurses, and a new era. It is time to do something new. That something new is to take your skills directly to the consumer and to the patient. Forget the overpaid CEO that doesn't know your name. You have the ability to be your own boss. I would like to introduce you now to RN Health Coaching. In the field of health coaching, what has helped me the most was when I discovered the 3W formula, which is comprised of 1, weight loss coaching, 2, worksite wellness, and 3, withdrawal from smoking. Executing this 3W formula has brought me to where I am at today. Let's dive a little bit deeper into each area. The first is weight loss coaching. This area covers 4 basic components. First, we begin with assessment. This consists of taking such things as vitals, measuring body fat, and determining BMI, hormonal balance, dietary supplements, and evaluating the medications of our clients. Now, once your client has been assessed and goals are made, we move on to the second component of weight loss coaching, in which I call the light diet. Now, in further training, we'll talk a little bit more about the light diet, but what a light diet basically is a diet including calorie reduction, protein, and fiber with every meal, tapering carbohydrates, and making sure we use caloric-free drinks. The third component in weight loss coaching is to execute, of course, light exercise. A light exercise program is put in place to get patients moving to boost their metabolism. This fitness system includes a goal of 10,000 steps every day. Our clients ensure that they're getting their 10,000 steps every day, which is the magic number, by wearing a pedometer, which, guess what, coaches, is branded with your RN Health Coaching business on it. The fourth and final component to weight loss coaching is what I call light motivation. Now, this consists of weight loss coaching that leads patients to success through goal setting and rewards for accomplishments. We'll talk more and more about this in the training. In the further training, health coaching empowers patients to take control of their weight and improve their overall health outlook. The second component of the 3W formula is worksite wellness. As risks come down, so will costs. Employees can take a reactive approach to healthcare, continue to pay for problems after they occur, and watch costs skyrocket. Or what they could do, coaches, is take a proactive approach where they invest in the plan and wellness of their employees and lower healthcare costs and improve productivity. And guess what? You, as an RN health coach, can show this business owner exactly how they do that. Further instructions in our course will show you just how. The last component of the 3W formula is withdrawal from smoking, or smoking cessation. Fewer than 3% of smokers who try to quit on their own are successful. We use evidence-based program based on asking if the individual smokes, advising them to quit smoking, assessing their willingness to quit, assessing or assisting with intervention, and arranging for follow-up progress. This RN health coach training can provide you with the tools to meet the needs of patients in these and other areas. With the right training, you can take the nursing expertise that you already have and apply it in specific areas that make a difference in the lives of patients. So nurses, those are some of the areas that I have come to be successful with promoting in the area of RN health coaching. What type of area appeals to you? Chances are you have an idea in mind that you would love to focus on. Great. Give me your comments below and let me know what that is. Please make sure you download the special report that I have provided for you. Make sure you have opted in with us with your name and email to ensure that you receive the full training, the full free 3-series training that you will receive from us. If you haven't, log in to healthcoachnursingjobs.com. That's healthcoachnursingjobs.com. Leave your name and email address to ensure you receive this free training in your entirety. Make sure you download the report. Leave me your comments below and let me know what this area that you like to focus on is. And I look forward to hearing all about it, nurses, and working with you to develop the customized RN health coaching training program. I will see you in video number 2. Do good, help others, make a difference, and I'll see you soon.